what really sparked my interest in HS is that in Detroit, we care for a really diverse population, and some of the sickest patients we see on a day-to-day basis are those who are struggling with HS or hidradenitis suppurativa. Um, I really felt there was a huge need for treatments that worked, and part of the reason that some physicians are not comfortable caring for this condition is um, there's a great need to better understand what causes it and to have effective treatments. Adalimumab, which the study focuses on, is now one of three FDA approved treatments for this condition. And all three of them only have about 50% efficacy, give or take. So there's a lot of room for improvement there. Um, and then I just love that caring for HS patients is multimodal. You might be seeing them on a day that they're doing relatively well, but it's a chronic condition that affects, impacts work, relationships, education more so than a lot of other dermatologic conditions. And that's another kind of impetus why I've chosen to study this condition. There's been a lot of interest in this area. Our lab has focused on doing blood immune profiling. So essentially using a relatively new technology called CyTOF, we're able to quantify the different populations of immune cells in the blood. This has been done more locally, like from skin biopsies and so forth, but nobody has really looked at the immune cell populations in the blood. And we think that this has likely clinical significance because we know that HS is not just inflammation in the skin, it's systemic inflammation that affects other organ systems as well. And so some of the preliminary data our lab generated shows that one particular biomarker, CD38, that was upregulated or in that expression was higher in a number of different immune cells in HS patients versus control. And also those with a higher population of CD38 positive intermediate monocytes were more likely to have failed adalimumab sometime in their treatment course for HS. So that was a really exciting signal to be able to potentially use this biomarker to distinguish those who would and would not respond to adalimumab upfront. Because from experience, some patients are able to stay on this medicine with really dramatic response for years, and for others, it doesn't work at all. And we're stuck playing a trial and error game, kind of wasting resources, wasting the patient's time until we're able to get to a therapy that works.